Hi, everyone. Welcome. We'll get started in just a second. Okay, we'll go ahead and get started. Welcome, everyone. I'm pleased to be with you all today. I'm Dr. Shoshana May. I am a clinical assistant professor and licensed clinical psychologist, as well as a pediatric neuropsychologist at the NYU Child Study Center. And today we're going to be talking about an overview of a neuropsychological evaluation, what to expect from the process, and really trying to empower parents to understand this process. So, what is a neuropsychological evaluation? So, neuropsychology as a field is a highly specialized subfield of psychology that focuses on brain behavior relationships. A neuropsychological evaluation is a comprehensive assessment of cognitive, academic, emotional, and behavioral functioning. And we'll get into what that means in terms of all of those different domains. The goal for a pediatric neuropsychological evaluation is to identify a child's strengths and challenges. Typical referral questions include learning difficulties, attention challenges, social issues, anxiety, depression, behavioral issues, and more. So, why might your child need a neuropsychological evaluation? There are many reasons why a child might benefit from one. First might be to understand their struggles in school. What's getting in the way of them succeeding academically? Is it a learning challenge? Is there a behavioral or emotional challenge? Attention difficulties? You might have concerns about your child's development. So maybe they're not progressing compared to their same age peers at the same pace. You might notice a lag in development compared to their siblings. And it can be related to any area of functioning. It can be academically, it can be socially, emotionally, behaviorally. They might not be meeting their developmental milestones as expected. Maybe a pediatrician has brought up concerns. And so when we think about developmental milestones, these might be language delays, motor, both gross and fine motor, toileting, social emotional developmental milestones. You might have concerns about their behavior. They might have difficulty regulating their emotions or their behavior, trouble starting and finishing tasks, planning to complete tasks and organization. Really, the crux of a neuropsychological evaluation is to clarify, right? We want to get clarity. And in one way, that does mean diagnostic clarity, right? So we want to see if there's any neurodevelopmental or psychiatric disorder that's getting in the way of a child being able to succeed in all areas. So, for example, you might be concerned about the presence of a possible ADHD, any learning disorders, dyslexia, dysgraphia, dyscalculia, an autism spectrum disorder, language disorder, behavior disorders, anxiety, and depression. And really, after we clarify those diagnoses, we want to make a plan, right? This will all inform treatment, right? And diagnostic clarity is crucial because we know how to treat all the different disorders I just talked about, neurodevelopmental and psychiatric, but we need to know what we're treating, right? In order to make a plan for addressing their challenges. We also want to inform school support. So, what should the school be doing? Let's say the child is struggling in school, but you don't know what kind of help or support they need. A neuropsychological evaluation can be very helpful in clarifying how a child learns, why they might be experiencing learning difficulties, and considering effective teaching methods. Again, we know how to treat a lot of these disorders and what is evidence based, meaning what has been proven to be effective in research studies, but we have to know what we're treating so that we can implement the right plan. So there are a few different steps in the process of a neuropsychological evaluation, which I want to review with you all. So the first thing that you do after you schedule your evaluation, you have your dates, you're ready to go. The first time you meet your neuropsychologist, will be during the initial consultation. Sometimes they call it an intake as well. This is really conversational, right? It's designed to gather the full picture of the child, right? So we're, as neuropsychologists, basically collecting data from you, right? We want to understand, excuse me, what's bringing you in for the evaluation, what concerns you have, and what questions you'd like answered through the evaluation, right? So we're really trying to goal set. What do you want to walk away from this evaluation with a better understanding of? We'll also be taking a full history. So I always tell parents, we're taking it all the way back to birth, right, of the child. We're going to be talking about developmental history, medical history, psychiatric and psychological history, academics, social functioning. Like, I want to get the full picture of how your child has been doing from birth to current. And at the end, or sometime during the intake, you'll talk about what you can expect during the evaluation process, right? So you talk about the evaluation sessions, how they're structured, what's going to happen after the evaluation session, feedback, and the report, which we'll be all reviewing today. When we then turn our attention to the evaluation sessions, so depending on your child's age, their challenges, the referral questions, so again, what those goals are, the evaluation can take place over the course of 1 day, 2 days, or even more if needed. The pediatric neuropsychologist will design the evaluation sessions to be very child-friendly, engaging, and, as I always say, hopefully fun. I really try to create a positive and warm and non-judgmental environment to help the child demonstrate their capabilities. The sessions are very structured. They're of varying lengths, and we say that because every child works at their own pace, right? So I am always assessing for effort, attention, motivation, fatigue, right? And we're taking breaks, right? If I'm working with a child for a number of hours, we're taking breaks periodically to support those areas. We want their best effort. So everything that we do to design the evaluation session is with the goal in mind of getting their best effort and getting the best data possible. During breaks that I mentioned, the child can have a snack, use the restroom, relax with their parents or guardians. I call them brain breaks, right? So just a little bit of rest since they're working super hard. Once we're done with the evaluation sessions, we've collected all of the data that we want to, we will then have a feedback session. The timeline is dependent based on neuropsychologist, but it's generally a few weeks following the evaluation sessions to give us time to put together all the data and to put together a whole picture, right, of a child's functioning. And that's what we review at the feedback session. We review the results of the evaluation. We walk through all the domains of cognitive and academic functioning that we looked at, which we'll get to next. And we put together this overall pattern of a child's unique strengths and challenges. We talk about diagnoses, if applicable, and then we get to the plan. We get to the personalized recommendations. So we put together what we think is the best plan moving forward for your child and for your family. So we'll talk about treatment. What type of therapy might be indicated, parent support, a possible medication referral. We talk about school. What is the school plan? What accommodations does the child need, both classroom accommodations, testing accommodations. We talk about the development of an IEP, right, the individualized education plan, or a 504 plan. And really I try to help demystify all these different acronyms as well that I've started to throw at you all. We talk about maybe a behavior plan is indicated in school. What academic support do they need? Is the school that they're in the right fit for their learning style based on what we've learned? And then after we make that plan, sometimes when indicated, we can also provide child feedbacks. And these are done in a separate session, and the results of the evaluation are delivered in a developmentally appropriate way. Then, following the feedback session, a report is generated. A report is always generated from a neuropsychological evaluation. It generally includes the background and the history, the testing results, summary and diagnoses, and recommendations. And the report is really used to help, first of all, you as parents understand your child's strengths and challenges. And then we also want to inform the other people who work with your child, right? So psychologists, psychiatrists, therapists, occupational therapists, physical therapists, speech language therapists, teachers, and their school to understand the child better. A neuropsych report can also be used to help access services. So let's say we want to develop an IEP for the student, right? The report is going to be instrumental in that process. Let's say we want to advocate for the child to receive state or federal services. A report can help advocate for that process. So it's a big piece of the advocacy so that we know what are we doing with these results to best help and support the child. So when I say cognitive and academic functioning that we assess, what do I mean? That's a sort of cognitive is a very sort of broad, ambiguous term. So let's get into the weeds about it. When we're assessing a child, there's no one size fits all approach. A neuropsych eval is really tailored to the specific needs and concerns that you have about your child. And a neuropsych eval in general is thought of to be the most comprehensive look that you can get at someone's cognition and at their academic functioning. So for example, we look at someone's overall intelligence, or otherwise known as IQ, which is composed of a number of different constructs or skills. So for example, their ability to reason with information, to problem solve, their ability to express themselves, their ability to hold information in their mind, how fast they work, right? All of these pieces encompass someone's intelligence. We look at other areas as well. We look at someone's attention, their ability to remain focused, not get distracted. We look at someone's executive functioning. Executive functioning is a very much this buzzword, I feel, that I think we could do a better job of explaining. But executive functioning is any skill that you need to get from point A to point B. So any goal-directed task, right? What skills do you need to get from A to B? So these are things like planning and organizing. These are things like monitoring your performance while you complete a task, your ability to start and finish the task. Then we have language. How does someone understand language? How does someone express themselves using language? How does someone use language in social situations? We look at visual motor, visual perception abilities, right? How does someone understand their visual world and their surroundings? We look at memory, verbal memory, visual memory. How does someone learn and remember information? We look at someone's fine motor skills, right? So both with their dominant and non-dominant hands. What does their handwriting look at? How are they able to execute fine motor tasks? We look at academics. So generally speaking, split up into reading, writing, and math. We look at someone's overall social skills, social functioning, and also their emotional functioning as well, their mood, anxiety, behavioral issues. And then we also look at someone's adaptive functioning. And adaptive functioning is just your ability to carry out the tasks that you need on a daily basis, your daily living tasks. So these are all the areas that we assess in a neuropsychological evaluation. And based off of a child's performance on these measures, along with the integration of your report and your ratings, teacher report and ratings, information from anyone else in their life who works with that child, that is what we use to generate the child's overall profile of strengths and challenges. It's also really important to note that diagnoses are never made based off of one piece of information or one score, right? It's based off of the integration and the patterns that we find. I sometimes will describe myself as a pattern finder. I am a data collector and a pattern finder. So that's hopefully a helpful analogy. It's not a pass or fail process with any of these measures, right? It's just an opportunity to understand your child better. So if you ask us, well, how is this going to help my child? So to reiterate, an evaluation helps you gain clarity. I feel very strongly that at the end of a process of a neuropsychological evaluation, you will have more clarity, right? You will understand how your child learns. You'll be able to identify their strengths and their challenges, and we'll be able to make a plan for moving forward, right? Which I think is the most important, right? What do we do with all this information? And that plan includes, again, school supports, recommended therapies. And so, again, once we understand why a child is struggling, then we can provide better and more appropriate interventions. This can also, in turn, and very often does, help improve the child's self-esteem, right? If they are aware that they're struggling, we want to empower them, right, with the tools that they need to succeed and feel better about themselves, because as we know, that is a very important part of child development. We can also use a neuropsychological evaluation to track progress over time. So once a child has had a baseline or initial neuropsychological evaluation, we generally recommend reevaluation every few years in order to track the child's progress over time. Right? So with the plan that we make initially, how does the child do? Are they responding like we would expect them to, given the different supports that and different accommodations that we implement? Do we see areas of improvement based on this plan? Are there areas that they're continuing to struggling despite these recommendations? Are there even increased challenges? So we might need to tweak recommendations, especially as a child gets older. The demands and development changes, right? And then so do evidence-based interventions, especially at school, right? The way that we intervene for a child with dyslexia looks very different when they're a young elementary student versus middle and high school. And what's really nice is once we have this baseline neuropsychological evaluation, in future reevaluations, we can now very specifically track a child's progress, now not only relative to their same age peers, but also relative to their own performance, right, over time. So let's talk about some common questions that we hear. The first one, will my child feel stressed or judged? So pediatric neuropsychologists are experts in creating positive, non-judgmental, and fun environments for the child. As I said before, we want the best data and effort possible. And so we construct our sessions to align with those goals. So when we meet with a child, we're first introducing ourselves, we explain what we're going to be doing in developmentally appropriate ways. We work on building rapport, right? So I want them to feel comfortable. I'm going to have a conversation with them first. I want to learn about them. We might play some games, we might draw, depending on the age. Before beginning any kind of assessment, I'm always making sure that the child feels comfortable before we start the evaluation. How long does the evaluation take? So as I said before, every child works at a different pace, and every child comes in with different strengths and challenges. We'll generally be working together for a number of hours at a time, taking those periodic breaks as needed. If we work together on one day together, we do take a longer lunch break as well. What happens if my child has a bad day? That's okay, it happens. Again, as pediatric neuropsychologists, we are prepared for just about anything, and we're trained to handle quote unquote off days. So we're able to monitor for effort, fatigue, motivation, behavior, and attention. If we have concerns about a child's ability to engage in the evaluation and give their best effort, then we stop testing and we make a plan to reschedule or schedule an additional evaluation session. And remember, we're never basing our conclusions on one piece of data, right? Where it's the integration of all those pieces together. So what do you tell your child? How do you prepare them to come in for the evaluation? So I generally tell parents to give their child a primer as to why they're missing school, why are they going to this appointment? And I tell parents to tell the child, and then I tell them as well, that I'm a special kind of teacher, right? Because a neuropsychologist is going to mean very little to a child, honestly, let alone an adult. And so I want to make it more relatable, right? I want to give them some context. So I tell them I'm a special kind of teacher, and my job as a special kind of teacher is to figure out how kids think and how they learn. And I figure out what a child is really good at, what are their strengths, and what's harder for them. And I tell them, and I tell parents to tell them, everyone has areas that are easier for them and harder for them. And we want to know what those areas are so that we can figure out how to make what's harder for you easier. I tell them the way we figure out this information is through a lot of different activities together. I'm always careful with the word game because I don't want to set up a child's expectations to think, oh, we're going to be playing board games and card games or video games, right? This is great. No, it's different types of games. So I'll say like learning games or brain games, right? So they're going to solve puzzles. I'm going to ask them questions. We might draw. We're going to do some school stuff too. I always tell them it might feel a little bit like school as well, but it's different from school because this is not a pass fail type of test. It's different than school tests, and their only job is to work hard and try their best. If it's a younger child, you can explain to them that they can expect to be earning stickers. I use a lot of stickers and sticker charts that are geared towards a child's interests. We have a prize closet, right? We use these different tools to create a structured environment to give their best data and also to help facilitate them having fun and a positive experience. Other good tips is to try your best to make sure that the child gets a good night's sleep the night before the evaluation, because we know fatigue, right? I'm mentioning fatigue and effort and attention, right, can be influenced by sleep. So try to get a good night's sleep beforehand. Same along the same lines, have them eat a healthy breakfast in the morning so they come in fueled and energized and ready to go. Really, this is all going to help to make sure that their brains are working optimally, and that they can put forth their best effort. Then finally, the evaluation comes to a conclusion with the feedback session. So the feedback session is this collaborative process where parents are active participants, right? So I encourage it to be as conversational as possible so that you can ask all of your questions and so that you leave with a clear understanding of next steps. We discuss the findings. So I'm talking again about that pattern, the pattern of strengths and challenges, any diagnoses that are indicated, and how we came to those diagnostic conclusions. Then I always say I hope to spend the most time, right, pulling together a plan. I want to make a plan for at home, for at school, for treatment like therapy. I encourage parents to take notes. I encourage them to ask questions. It's a lot of information to take in, certainly, but it ultimately leads to clarity, right? That helps to better understand your child and why they might be displaying certain challenges or why you might have certain concerns. It works differently depending on the neuropsychologist, but sometime following the feedback session, you can expect a full, formal written report of the findings that is yours for use to help yourself understand your child better, those that work with your child to understand them better, and to help advocate for services, right? So again, going back to that school planning piece. Okay. Then following the feedback session, as I mentioned earlier, when indicated, we can do a child feedback session where we deliver the results of the evaluation to a child in a developmentally appropriate way so that they can understand, right, their strengths and challenges. And that in turn helps them advocate too for what they need as well. So I will conclude with that. I wanted to leave time for questions. I also have some links here that we are going to pop into the chat as well. If you'd like to learn about our Child Study Center and all the different services we have, if you'd like to schedule a phone intake to talk about the different services if you're looking for them, and then also a link to my profile so you can learn more about my background. I'd be happy to take questions. I see a hand raised. So if you want to put your question into the chat. Okay, I think there was a hand raised. You can go ahead and let us know your question. Okay, I have some other questions in here too. I will go ahead and start with, someone asked, when is the best time to get this evaluation, or what age? That's a very good question. So it really depends, right? There are so many different times during a child's development when you might have questions or concerns come up. There are ways to evaluate a child really as young, as 2 or 3 years old. At that point, we're really measuring sort of very broad areas of functioning. We're not going to be able to get as specific because there's so much happening and so much development happening quickly. Um, I will say it really depends on your concern and how long you've had the concern. If you've tried to get some explanations, right? If you've tried to talk to teachers about any concerns they're seeing, or you've tried to initiate services with school, if things are getting more difficult to manage at home, right? So if things are not getting better, even when you're trying to troubleshoot, I would say that's a great time to come in. So another question we have from the chat is, how does this work for a child who is non-speaking? Which is a fantastic question. I appreciate someone bringing this up. So for a child who is non-speaking, or what we might call nonverbal, um, it conducting a neuropsychological evaluation becomes trickier, no doubt about that, and more complicated. However, we as neuropsychologists are trained to understand someone's cognition not only verbally, but also non-verbally, right? What is their ability to problem solve without language? What's their ability to execute different academic tasks that you don't need language for? And so there are measures in the areas of functioning that I reviewed, that whole wheel, where we can take a look at someone's functioning, even if they are non-speaking. Generally, it should be a neuropsychologist who has a level of expertise or a specific area of expertise, because again, it is a highly specialized field. So if you're pursuing an evaluation, I would make sure that that's an area that your neuropsychologist feels comfortable assessing. Another question, do we take insurance? And if not, what is the cost? So we take, at the Child Study Center in general, we take a number of different employee-based plans. So we take NYU Langone employee insurance, also NYU Washington Square Park, so the university's insurance, and a number of other participating companies as well. Which is fantastic. It's a great way for these people who have those insurance plans to access evaluations at a much, much lower cost. If not, we also do provide evaluations, what we call private pay, and a full comprehensive neuropsychological evaluation for neuropsychologists and me as well is $6,500. We also understand that this is a very costly process, and so we do have our billing department submit a courtesy bill to your insurance to try to get some out-of-network reimbursement benefits. And so we do try to work as best we can with families to make this as accessible as possible. We also have trainees on our team who have lower cost evaluations as well. Okay, someone else asked, how do you assess issues around social interaction and social communication in a one-on-one evaluation? It's an excellent question, right? Because again, that's the setting that I'm seeing the child in, is one-on-one, right? So they're with an adult and I'm trying to probe and understand their social functioning. It can be difficult, right? Because I'm not seeing them in their natural setting. So one way we do this is through classroom observation. So we'll actually push into classrooms and observe the child generally before we begin testing, so that they don't know, who we are and what we're doing there. So we don't influence their behavior. So we'll do kind of like a naturalistic observation. And then again, I'm collecting data from a lot of people in their lives. So I love to talk with whoever is involved in their lives, their teachers, any therapists, tutors. I talk to many, many people as I can, again, because I'm that data collector, and I'm asking them, how does the child interact socially, right? And then so I'm relying on their report as well. Do we accept DOE referrals? We used to accept DOE referrals. We do not anymore because of issues with receiving reimbursement from them. Insurance may cover the cost. It really depends on your specific insurance plan, and I encourage everyone to call and find out their benefits, and also find out what their out-of-network benefits are. And you're right, it is costly, and it is not, we as neuropsychologists, and I'm on different state and committees and organizations to try to make neuropsychological evaluations more accessible and be covered under insurance, to really try to increase access. Okay, I know we're at time, or we're actually past time, so I'm just looking to see if there's a quick last question. How long does it take to get an appointment? So at times, depending on the time of year and just the amount of providers available, it can take a number of months to get in for evaluation. I will say that at our Child Study Center right now, we are absolutely accepting referrals. We'd be happy to see your children, and we don't have too long of a wait list as of now because we've recently expanded, which is fantastic. The Child Study Center does not accept Medicaid. I'm sorry. Someone had asked that question. Okay. Then another question, someone's children have ADHD. They see a neurologist for medication management. And their son has some social issues. So that's a great question. Who should they see? I would actually suggest scheduling an appointment using the link that says schedule an appointment, because what that does is send you to our intake team, who then will have a conversation with you and understand what your concerns are. And then they make recommendations as to which team you're referred to. So is that a psychologist? Is that a neuropsychologist? Is it a psychiatrist, right? So I would click on schedule an appointment to get some more clarity on that. Okay, I know we are over time. I'm sorry I did not get to everyone's questions. Again, my profile is in the chat, so I'd be happy to talk with people if they have other questions. I really appreciate everyone's time and attention today. Thank you so much. The full list of upcoming webinars, as well as recordings of previous webinars, can be found at nyulangone.org/CSC webinars. Thanks again. Bye.